Hi, it's Dr. William. What's the difference between a waist trainer and the new FibroGuard? Well, simply put, one doesn't work and one works. Let me explain. They look the same. In fact, they go on the same. The FibroGuard really looks like a waist trainer. It has Velcro. You open it up, you put it around your body, and you cinch it in. That's where the similarities end. You cannot wear a waist trainer and end up with a smaller shape to your body. That's not how the body works. You can't just squeeze something. Temporarily, it will give you a smaller waist because your inside, your guts basically, will go up into your chest and down into your pelvis. But this is only temporary. Once you take the waist trainer off, the guts just go back to their normal position and your waist hasn't changed in size at all. So I know that's a little controversial because people love waist trainers and they're convinced that they work, but they don't. They don't actually change the shape of your body, only in a temporary way. Let me speak about the FibroGuard. This product works. This is a completely new, revolutionary product designed to give patients smooth, soft, supple skin following liposuction. How does it work? Well, I mentioned it goes on just like a waist trainer in the same way. It has hook and eye system. And so that will allow you to get a nice, comfortable fit on your body, but inside is where the magic happens. Inside, it's filled completely with these small half spheres of foam. And you wear this directly on top of your skin, underneath your faja. You start this at 2 weeks after having liposuction. And what that does is it keeps the fascia soft. The fascia is that all-important strong material that all of us have. It's why our bodies stay together. If we didn't have fascia, all of our bodies would just be like a soup and our head would end up at our feet. So fascia is super important. It's very strong. It keeps our tissue together. The problem comes in after you have liposuction. If you overcompress, you can squeeze that fascia down too much. It'll scar like that. It'll stay like that. And it'll leave you with lumpy skin. And it'll even cause fibrosis, which is a permanent change to the fascia, leaving you with very lumpy, bumpy skin after liposuction. So, enter the FibroGuard. You wear this 2 weeks after your liposuction. It goes directly on your skin. These little microspheres go right on top of your skin. And what these are doing is they're mimicking a manual lymphatic drainage where the lymphatic channels are open. You open up the lymphatic channels, the fluid, the swelling around the fascia goes down, and you get rid of that fluid on your own. You just excrete it, you just pee it out by yourself. These little foam microspheres, when they're against your skin, just with breathing, just with respiration, where you're just naturally breathing in and out, generates some movement, micro movements, very, very tiny movements. And it's those very tiny movements that are in the superficial layer of your skin that will start to remove that fluid. And that's what keeps your fascia nice and soft. And that's what then keeps your skin nice and soft. So while these two products look very similar, they are completely different products. You don't use the FibroGuard as a waist trainer. It goes on in the same way, but we don't want you cranking this down as tight as you possibly can to be able to get the smallest waist. That's not what the FibroGuard is doing. The FibroGuard goes on snugly, so it just fits comfortably underneath the faja, directly against the skin, and it allows these little micro foam balls to work their magic to keep your skin and fascia nice and soft, prevents fibrosis. That's why we call it FibroGuard. Prevents fibrosis and gives you the best skin with your massages, your foams, your boards, your rollers, your faja, with all of those things together. This supplement helps you get the very best skin after having liposuction. Don't be somebody that ends up with a great shape after having liposuction only to have that ruined by fibrosis. Or if you don't have fibrosis, you can still have a mild degree of that fascial scarring, which will give you lumpy skin. Don't be that person who gets a good shape but then is unhappy and can't wear a bikini to go to the beach to show off their new body because the skin doesn't look good. We want you to get the very best skin after liposuction so your great shape is matched with your great skin so that you have a really good result and people can't tell that you've had liposuction.